I welcome you back to this channel. In this 6th episode of Target Nursing Officer exam video, we will discuss some of the important MCQs for NEIGRIHMS exam. Question number 1. The following are the hormones which increases blood pressure except. Here we have to concentrate on this word except. Option given, adrenaline. Option B, acetylcholine. Option C, vasopressin. Option D, angiotensin. What is the function of adrenaline? Adrenaline helps increase heart rate, thereby increase blood pressure. So this is the hormone which helps in increasing blood pressure. And what is acetylcholine? It is the neurotransmitter. And this acetylcholine contracts smooth muscles, dilate the blood vessels, and thereby slow the heart rate also. And vasopressin, also known as antidiuretic hormones, it also helps in increasing the blood pressure by constricting the blood vessels. And angiotensin also helps in increasing blood pressure by constricting blood vessels and by triggering water and salt intake. So the correct option here is option B, which is acetylcholine. Among all these hormones, acetylcholine does not increase blood pressure. Question number 2. The connecting link between the fetus and the placenta through which the fetal blood flows to and from the placenta is called option A, fetus, option B, foramen ovale, option C, ductus arteriosus, option D, ductus venosus. Option A is the correct answer. Fetus. Fetus is another name for umbilical cord. And foramen ovale is the hole between the right and left atrium. And ductus arteriosus is the vessels that connects the pulmonary artery to the aorta in fetus. And ductus venosus is the shunt that connects the intrahepatic portion of the umbilical vein to the inferior vena cava. These are all present in the fetus, which later close in life. So we can see here in the picture, here is the foramen ovale. Here is foramen ovale is a hole between the right and the left atrium. And then this one is the ductus arteriosus. Here is the ductus arteriosus, which connects the pulmonary artery to the aorta, and here we can see is the ductus venosus. Here is the ductus venosus. Question number 3. The delusional belief that others, ourself, or the world do not exist is called option A, delusion of infidelity, option B, delusion of grandeur, option C, nihilistic delusion, option D, mode incongruent delusion. Correct option here is option C, which is nihilistic delusion. Is a type of delusion in which a person believe or have delusion that he himself or herself or the world does not exist. Delusion of infidelity is a type of delusion in which a person believe like his or her lover are unfaithful. Delusion of grandeur is the type of delusion in which the person thinks like he is an important person, believe that he is an important person or person with power or special person. Mood incongruent delusion is a type of delusion that has no relation or association with mood. It's a delusion that has no association with mood, or this type of delusion does not match with the mood of the patient. Like for example, the depressed patient may believe he is being targeted or controlled. Question number 4. An acidic base imbalance which is marked by decreased PaCO2 and increased pH is called option A, respiratory acidosis, option B, respiratory alkalosis, option C, metabolic acidosis, option D, metabolic alkalosis. Option A, in case of option A, in case of respiratory acidosis, the pH will be low, whereas the PaCO2 will be high. In case of respiratory alkalosis, the pH will be high and the PaCO2 will be low. In case of metabolic acidosis, pH will be low and the bicarbonate will be low. And in case of metabolic alkalosis, the pH will be high and the bicarbonate also will be high. So the question here it says the acid base imbalance in which the PO2, PaC or PCO2 is low, is decreased, whereas the pH is increased. So the correct option here is option B, which is respiratory alkalosis. Question number 5. A type of family in which the female is the head of the family and also the custodian of property is termed as option A, patriarchal family, option B, matriarchal family, option C, patrilineal family, option D, matrilineal family. Option A, patriarchal family. What does it mean? It means the ruler or the head of the family. Head is man or husband, we can say, and the property is passed from father to his son. Whereas in case of matriarchal family, the ruler or the head is the woman or the wife, and the property is passed from mother to her daughter. And what does patrilineal family means? It is in this type of family the relatives are identified by tracing the descent exclusively through males from a founding ancestors. Whereas in matrilineal family, the identification is through the mother's line, or through the wife, or through the mothers. So the correct option here is option B, which is matriarchal family is a type of family in which the female is the head of family and also the custodian of the property. Question number 6. Inability to experience pleasure in any activity is called option A, anhedonia, option B, ambivalence, option C, autism, option D, amnesia. Correct option here is option A, which is anhedonia, is the inability to experience pleasure in any activity, Ambivalence is the coexistence of two opposite drives or desire, or it's a conflict to do or not to do. Autism is the developmental disorders. Amnesia is the partial or total loss of memory. Question number 7. The Bangle test is an assessment method to rule out option A, fracture, option B, anemia, option C, malnutrition, option D, hemophilia. The Bangle test, what is it? The Bangle test is the quick assessment tool to assess the arm circumference. And how is it done? It is done by using a ring of 4 cm of internal diameter, and this ring is slipped. Suppose this is the arm of the children, and this ring is slipped up the arm of the children, and if the ring pass the elbow of the children, so it considered to be malnourished, and his arm circumference to be less than 12.5 cm. So the correct option here is option C, which is malnutrition. Bangle test is an assessment tool to rule out malnutrition. Question number 8. Carpopedal spasm induced when blood flow to the arm is occluded using blood pressure curve causing ischemia to the distal nerve are called option A, Chvostek sign, option B, Trosse sign, option C, Meswen sign, option D, Rosing sign. Correct option here is option B, which is Trosse sign, and Chvostek sign is the increased irritability of the facial nerve manifested by twitching of the ipsilateral facial muscles on percussion over the branch of facial nerve. And Meswen sign is the sign used to help diagnose hydrocephalus. Rosing sign is the sign when the lower quadrant or the lower abdomen is palpated. Suppose palpate in the left side, and the pain will be elicited or felt in the right side, in the right lower abdomen when palpate in the left lower abdomen, and it is the sign of acute appendicitis. Question number 9. A type of questionnaire in which consists of a series of contrasting adjective pairs listed in opposite ends of bipolar scale is known as option A, Likert scale, option B, checklist, option C, semantic differential scale, option D, visual analog scale. Correct option here is option C, which is semantic differential scale. Question number 10. Polio virus is primarily transmitted by option A, infected needles, option B, in respiratory route, option C, animal bites, option D, fecal-oral route. Correct option here is option D, which is fecal-oral route.